Curious about Clopidogrel and its possible uses? We have all the information you need right here. In this video, we will unravel the typical uses, benefits, potential side effects, recommended dosage, and risks associated with Clopidogrel. Whether you are a healthcare professional or someone seeking information about this medication, we've got you covered. Clopidogrel, also known by its brand name Plavix, is a widely used medication that belongs to a class of drugs called antiplatelets. It works by preventing blood clots from forming in the body, reducing the risk of heart attack, stroke, and other cardiovascular problems. It is commonly prescribed to individuals who have had a heart attack, stroke, or other blood vessel disorders. While Clopidogrel can be highly beneficial in preventing life-threatening complications, it is essential to be aware of its potential side effects and follow the recommended dosage. This video will provide you with detailed insights into the uses, benefits, risks, and dosage guidelines for Clopidogrel. So, read on to gain a comprehensive understanding of this medication and make informed decisions regarding your health. What is Clopidogrel? Clopidogrel, also known by its brand name Plavix, is a widely used medication that belongs to a class of drugs called antiplatelets. It is primarily prescribed to individuals who have had a heart attack, stroke, or other blood vessel disorders. By preventing blood clots from forming in the body, Clopidogrel reduces the risk of life-threatening complications such as heart attack and stroke. How does Clopidogrel work? Clopidogrel works by inhibiting the action of platelets, which are small blood cells responsible for clotting. When an injury occurs, platelets clump together to form a clot, which helps in the healing process. However, in certain situations, these clots can block blood vessels, leading to serious health issues. Clopidogrel prevents platelets from sticking together and forming clots by blocking specific receptors on the platelet surface. This helps maintain a healthy blood flow throughout the body and reduces the risk of cardiovascular problems. Typical uses of Clopidogrel. Clopidogrel is commonly prescribed to individuals who have experienced a heart attack, stroke, or other blood vessel disorders. It is also used in combination with aspirin for patients who have received stents to keep their arteries open after undergoing procedures such as angioplasty. Moreover, Clopidogrel may be recommended for people with peripheral artery disease, PAD, a condition in which there is a narrowing of blood vessels in the legs, arms, or abdomen, reducing blood flow to these areas. By preventing the formation of blood clots, Clopidogrel helps improve circulation and reduce the risk of complications associated with PAD. Benefits of using Clopidogrel. The primary benefit of using Clopidogrel is the prevention of life-threatening complications associated with blood clot formation. By inhibiting platelet aggregation, Clopidogrel significantly reduces the risk of heart attack, stroke, and other cardiovascular problems. For individuals who have undergone procedures such as angioplasty or received stents, Clopidogrel plays a crucial role in preventing the formation of blood clots around the implanted devices. This ensures that the arteries remain open and blood flow is maintained, reducing the likelihood of further complications. Furthermore, Clopidogrel offers long-term protection for individuals who have previously suffered from a heart attack or stroke. By consistently taking this medication as prescribed, patients can significantly lower their risk of experiencing a recurrent event. Potential side effects of Clopidogrel. While Clopidogrel is generally well tolerated by most individuals, it is essential to be aware of potential side effects that may occur. Common side effects include bleeding. One of the primary concerns with Clopidogrel is the increased risk of bleeding. This can manifest as nosebleeds, blood in the urine or stool, or prolonged bleeding from cuts or injuries. In rare cases, severe bleeding may occur and require immediate medical attention. Digestive issues. Some individuals may experience stomach pain, indigestion, or diarrhea while taking Clopidogrel. These symptoms are typically mild and temporary. Allergic reactions. Although rare, some individuals may develop allergic reactions to Clopidogrel. Symptoms may include rash, itching, swelling, severe dizziness, or difficulty breathing. If any of these symptoms occur, immediate medical attention should be sought. It is important to note that the benefits of Clopidogrel in preventing serious cardiovascular events generally outweigh the potential side effects. However, it is crucial to discuss any concerns or unusual symptoms with a healthcare professional. Recommended dosage of Clopidogrel. The recommended dosage of Clopidogrel may vary depending on the individual's condition and medical history. It is essential to follow the instructions provided by the prescribing healthcare professional and not exceed the recommended dose. For individuals who have had a heart attack or stroke, the typical starting dose of Clopidogrel is 75 mg taken once daily. This dosage may be continued for several months or longer, depending on the individual's risk factors and response to treatment. For individuals who have undergone procedures such as angioplasty or received stents, Clopidogrel is often prescribed in combination with aspirin. The recommended dosage in this case is typically 75 mg of Clopidogrel once daily, along with a low dose of aspirin. Risks associated with using Clopidogrel. While Clopidogrel can be highly beneficial in preventing life-threatening complications, it is essential to be aware of the potential risks associated with its use. Some of the risks include bleeding. As mentioned earlier, Clopidogrel increases the risk of bleeding, including gastrointestinal bleeding, bruising, or nosebleeds. It is important to be cautious and seek medical attention if any signs of bleeding occur. Drug interactions. Clopidogrel may interact with other medications, including certain antidepressants, anticoagulants, and proton pump inhibitors, PPIs. These interactions can affect the effectiveness of Clopidogrel or increase the risk of side effects. It is crucial to inform healthcare professionals about all medications being taken to avoid potential interactions. Genetic factors. Clopidogrel's effectiveness can vary depending on an individual's genetic makeup. Some people have a genetic variation that affects how their bodies metabolize the medication, reducing its effectiveness. Genetic testing may be recommended in certain cases to determine the most appropriate treatment approach. Precautions and considerations when using Clopidogrel. When using Clopidogrel, it is important to take certain precautions and consider specific factors to ensure its safe and effective use. These precautions include informing healthcare professionals. It is crucial to inform all healthcare professionals involved in the individual's care about the use of Clopidogrel. This includes dentists, surgeons, and other specialists, as the medication's effect on bleeding may impact certain procedures. Avoiding certain medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, should be used with caution or avoided altogether while taking Clopidogrel, as they can increase the risk of bleeding. Discussing pregnancy or breastfeeding. Clopidogrel's safety during pregnancy or breastfeeding is not well established. It is important to discuss the potential risks and benefits with a healthcare professional before using this medication in these situations. Monitoring blood tests. Regular blood tests may be recommended to monitor the individual's response to Clopidogrel and assess any potential side effects, such as changes in liver function. Alternatives to Clopidogrel. In some cases, individuals may not tolerate or respond well to Clopidogrel. In such situations, alternative medications may be considered. Some common alternatives to Clopidogrel include aspirin. Aspirin is another antiplatelet medication commonly used to prevent blood clots and reduce the risk of heart attack and stroke. It works by inhibiting the production of certain substances in the body that promote platelet aggregation. Ticagrelor. Ticagrelor is an alternative antiplatelet medication that works by a different mechanism than Clopidogrel. It is often used in individuals with acute coronary syndrome and has been shown to be effective in reducing the risk of cardiovascular events. It is important to note that the choice of alternative medication should be based on an individual's specific medical condition and in consultation with a healthcare professional. Conclusion and final thoughts. Clopidogrel, also known as Plavix, is a widely used medication that belongs to the class of antiplatelet drugs. By preventing blood clots from forming in the body, Clopidogrel significantly reduces the risk of heart attack, stroke, and other cardiovascular complications. While it offers numerous benefits, it is crucial to be aware of potential side effects, follow the recommended dosage, and consider individual risks and precautions. If you have been prescribed Clopidogrel or are considering its use, make sure to discuss any concerns or questions with your healthcare professional. They can provide personalized guidance and ensure that Clopidogrel is the right medication for your specific needs. Remember, your health is of utmost importance, and being informed empowers you to make the best decisions for your well-being.